Hey everyone, thanks for checking out my channel. On this video, we're going to go over shoulder impingement syndrome or subacromial pain syndrome. That's where you have this pain in the front part of your shoulder, maybe on the outside, trying to reach overhead. That's just painful to be able to do that. Your arm feels weak. So you've been diagnosed with this pain syndrome, and so I'm going to go over some techniques you can work on to improve your range of motion, decrease your pain, increase your strength, and return full functional use of your upper extremity. So what is shoulder impingement syndrome or subacromial pain syndrome? So this arch right here is known as a subacromial arch. So if you're looking at my shoulder, it's kind of like this. My shoulder blade is sitting back on my ribs. There's the collarbone, the clavicle. The ball portion, the humeral head, it's thought that it's going to ride up. That's called superior humeral head migration or forwards. And it kind of pinches these structures in here, irritates them. You have the rotator cuff tendons in here. You also have a bursa sac that's in here. Either way, it just becomes sensitized. Now, a lot of times people think that there's this big magical open space and that space is taken up for different reasons, inflammation, swelling, whatever, and then that is causing that impingement syndrome. But in reality, it's always kind of being compressed a little bit. It's all jam-packed in there. Those tissues just become sensitized, inflamed for whatever reason, and now we got to work on range of motion and strength to restore function. Our first technique is going to be a distraction stretch. So if you've seen my videos in the past, you know that I really like this stretch. You can do it in sitting or standing position. What I'm going to do is grab a hold of the bottom of the table here. You can use a countertop, or if you're sitting in a chair, the bottom of the chair. I'm just going to lean away. And so that just performs a nice distraction stretch within the joint, just really pulling at the joint capsule itself, all the structures around. I'm going to tilt my head away from the area that I'm stretching. I'm going to hold that for around 10 to 30 seconds and relax. Go back into it again, 10 to 30 seconds and relax. And you're going to repeat that several times a day. I usually tell patients with that one, you can perform that just throughout the day, whenever you think about it. It's easy to do. You don't have to have any kind of additional material, just something to grab a hold of. Our next stretch is going to be a doorway stretch. I really like this because I feel like it stretches the full front area of the shoulders, the pec wall. You're just going to lean in, and as I do that, I really feel that stretching in there. I'm going to lean in. As far as hand placement, you can vary this. You can start down low, you can start a little higher. I usually tell patients just kind of go in this area about shoulder level, just what feels comfortable. You're going to lean in and feel that stretch, holding that for 10 to 30 seconds. Just repeat that throughout the day. You also can do that with the arms out in this position, so kind of externally rotated here. You can do that. That's a little more aggressive of a stretch. I recommend initially starting with your palms facing forwards and just kind of lean in like that. Again, repeat that several times a day. Now we're going to start working on strengthening some of the scapular muscles, the shoulder muscles. This is going to be an external rotation. So you're going to take a band, have this band fastened over to a door. You're going to keep the elbow in by the side and pull the band outward. So you're just kind of rotating, so you're pulling your hand away from your body. Repeat that for 2 to 3 sets of 10 to 12 repetitions. Now you can also perform that with, if you have a pulley system, a cable system, or even sideline with a dumbbell, you can do that as well. But for a lot of people, they may not have access to some of that equipment. These bands are pretty easy to come by. I'll put a link in the description for a set of these. But again, you're just going to keep that elbow tucked in, and over time, as your shoulder feels better, you can work on kind of bringing the elbow out more to where you're going in, like if you were a baseball pitcher, what's known as a layback position like this. But initially, you're just going to start with the elbow tucked in by your side. The next exercise is going to be a scapular retraction or a band row. You can do this again with a cable machine, or if you can bend over and do these with dumbbells, that's fine too. But I'm going to take this exercise band and I'm going to work on pulling it straight back, really squeezing my shoulder blade, kind of feeling that come around my ribs, come back forwards, pull back again, really squeeze that back. And again, you can also start to vary this where you bring your elbow a little higher out to the side, but initially keep your elbow pretty close to your side and pull that back for 2 to 3 sets of 10 to 12 repetitions. And just like the previous exercise, I would probably go ahead and do this on both sides. I typically have my patients, if we're going to perform this on one side, we're going to go ahead and perform it on the other side as well. Next, these are going to be serratus punches. So this is not a traditional kind of a chest press or a shoulder press type movement. What you're going to do with this is I have the band fastened behind me here. I'm going to work on keeping my elbow all the way out straight. So my elbow's all the way straight. So I'm not bending my elbow. It's going to stay straight the whole time. And then I'm reaching forwards and kind of dropping back my shoulder within the joint. So you can see that kind of from the side. I'm going to push forwards and drop back, forwards and drop back. So it's not this, not bending the elbow. I'm not saying it's a bad exercise, but I just personally like this exercise to work that serratus anterior muscle, and then of course some other supporting muscle groups. Perform that for 2 to 3 sets of 10 to 12 repetitions. This exercise is going to be a standing A. You can do this on your stomach. You can use dumbbells. There's a lot of variations of this. Again, just keeping it simple. take the exercise bands, fasten them to the top of the door with one of those attachment pieces, or in this case, one of these pieces that has the strap and the rings. So what you're going to do with this is you're going to basically keep the elbow straight. You're going to come down. It's like you're making the letter A. So you're coming down, making the letter A. So I'm going to squeeze my shoulder blades together at the bottom with that, come back up, squeeze my shoulder blades together. Perform that for 2 to 3 sets of 10 to 12 repetitions. Now we're going to perform standing band tees. So with this, what you're going to do is take the band about shoulder width apart and then pull that band apart so it's forming a capital letter T. So if my arms go out, that's the top portion of the T, then my body would be the vertical portion of the T there. If you don't have a band, you can do this with dumbbells. You can just bend over and work on doing this with dumbbells, almost like a rear delt fly or something like that. If you use dumbbells, make sure you're using a weight initially that's light enough that you really can feel those muscles working as far as those rhomboid muscles, those muscles between your shoulder blades and your spine, really able to squeeze that together. Perform that for 2 to 3 sets of 10 to 12 repetitions. Next, I'm going to perform a standing Y. So you can do this with dumbbells or, again, one of these exercise bands. I have the band under my foot, kind of holding it down. I'm going to work on bringing my hands up into the shape of a letter Y, and then come back down, go back up again, nice, slow, and controlled, and back down. Perform that for 2 to 3 sets of 10 to 12 repetitions. Now with that one, initially you may only go up to about shoulder level and back down, and that's fine. About shoulder level and back down, and eventually work on going all the way up to where you're going overhead. You're just going to kind of have to play with that just depending on what your pain levels are when you first start versus as you progress. And you can always progress to heavier weights, dumbbells, machines, just whatever you have. This is just a basic guide. When you're really inflamed, you're really just first starting to work with your program to restore that range of motion and strengthen your upper extremity. And you can always progress as things get better. Thanks so much for watching this video. I hope it helps your shoulder impingement syndrome. Be sure to hit that subscribe button so you can stay up to date on all my content.